Open enrollment for marketplace plans is around the corner, so it's time to start thinking ahead, looking at those 2026 plans and figuring out exactly what your enrollment strategy is going to be. So in today's video, we're going to give you a really comprehensive breakdown all about ACA marketplace plans. We'll go over the basics, the terminology, we'll discuss those big 2026 changes, talk about the 10 essential benefits, metal tiers, premium tax credits, and their possible expiration, navigating Healthcare.gov, and more. So first, let's start with some of those ACA basics and discuss the terminology, because the terminology on the marketplace can quite frankly be crushing if you're not fully versed. Now that being said, if you're already very familiar with the terminology, if you're looking for something specific that you want to research in today's video, because this is a very, very comprehensive guide, you may wish to jump ahead to a more specific chapter. So go ahead and take a look at the video chapters in the description below if in fact you do want to jump ahead. All right, back to it. So the ACA is the Affordable Care Act. And when we talk about ACA plans, we're also referring to marketplace plans, also known as Obamacare. It's really all one and the same. And it was designed as a way to offer lower cost coverage for those who don't have health insurance through their employer and don't qualify for Medicaid and can't afford private insurance. But there are many terms that you need to be able to understand in order to make the best possible decision for your healthcare needs. So first, let's talk about some of the costs associated with ACA plans or health insurance plans in general. The easiest to understand is your monthly premium. This is the amount that you have to pay out of pocket to keep your insurance active. Now, what you may notice is that you're eligible for a premium tax credit, also known as a premium subsidy. This is basically just a tax credit that's paid up front and is reflected in a largely discounted monthly premium. There have been huge changes with regards to premium tax credits, and quite frankly, we're still waiting on bated breath at the time of the recording of this video as to the future of those enhanced premium tax credits, which are set to expire at the end of 2025. You also need to understand the deductible, which is the amount that you have to pay out of pocket before your insurance begins to contribute to the cost share. With regards to the deductible, there's actually many services on ACA plans that are covered even prior to meeting the deductible, very often with no copay or coinsurance. Now, there can be a family deductible versus an individual deductible if you are on a family plan, and it's the same with the out-of-pocket maximum. This is the maximum that you would have to pay out of pocket for covered in-network services before your insurance carrier took on the remainder of the bills for the remainder of the calendar year. Now, these are set by the federal government. However, plans can choose to offer better benefits to entice beneficiaries. And just because there is a maximum out-of-pocket max doesn't mean your plan may not offer a lower out-of-pocket max, which may entice someone who has more extensive health needs. But those aren't really the cost changes that have been making the news. At the end of 2025, the enhanced premium subsidies, which were extended under the Inflation Reduction Act and American Rescue Plan Act, are set to expire, which means that many Americans could see their premiums skyrocket by as much as 75%. Currently, we're in a government shutdown waiting to see if the government will take action or make some type of decision with regards to the extension of these premium tax credits. But that's where things currently stand. So it may be more important that you budget more, if at all possible, towards your monthly premiums, or consider alternative options if an ACA plan is just no longer financially feasible. There are, of course, other ways to pick less expensive ACA plans, which we will talk about when we actually look at the plans in just a moment. And those aren't the only changes in the news. There have been changes to gender-affirming care as part of the 10 essential benefits and eligibility, especially for Dreamers. However, some of the other proposed changes have actually been halted due to a federal judge. For example, changes to special enrollments, that $5 monthly junk fee, more paperwork, etc. So again, we're sort of in limbo at this time, but as of the recording of this video, additional changes will not be imposed. Now let's talk about those metal tiers. So, ACA plans are organized into 4 different categories based on metal tier. There's bronze, silver, gold, and platinum. And don't let the names confuse you. A platinum plan doesn't necessarily mean it's better than a bronze plan. It simply has to do with the cost-sharing structure. Once your insurance begins to contribute, it will be responsible for a cost share, either in the form of a co-pay, which is a fixed amount, or a co-insurance, which is a variable amount. Co-pays are easier to understand. It could be $15 to visit your PCP, $25 for the urgent care, and $250 for the emergency room. Co-insurance is a variable amount, so generally speaking, we're talking about 20% or 40% of the actual cost of the service. And that's really where these metal tiers come into play. So a bronze plan will have a 60-40 split. Your insurance carrier will pay 60% of the bill and you'll be responsible for a 40% co-insurance. Silver is a 70-30 split, gold is 80-20, and platinum is 90-10. Now the way they make up for the cost sharing payments is through the monthly premiums. So you'll likely notice that platinum plans tend to have higher monthly premiums and bronze plans tend to be on the lower end of the spectrum. It's not always the case, but it is a pattern that you will notice. So when we're talking about ways to save money, this is very important. As I mentioned, generally speaking, those bronze level plans will have lower monthly premiums. So these can be better for individuals who have less extensive health needs. Yes, you may have to pay more when you actually utilize your insurance, but if you're someone who doesn't use it as frequently, having that lower monthly premium may be a benefit to you. Now, on the other end of the spectrum, if you are somebody who has more extensive medical needs, then a platinum plan that offers more comprehensive coverage, even with a higher monthly premium, may actually work out better for you. Also, silver plans may offer additional savings if you're someone who is eligible based on your income. And while we're talking about some of these inverse relationships, I'd also like to mention that generally speaking, there's an inverse relationship between premiums and deductibles. Usually plans with lower monthly premiums have higher deductibles, and plans with higher monthly premiums have lower deductibles. So just like when we're talking about bronze versus platinum, this can be a great way to save money as well. If you're an individual with less extensive health needs, a lower premium, higher deductible plan might work well, perhaps even a high deductible health plan, more on that in just a moment. Or if you're an individual with more extensive health needs, then perhaps a higher monthly premium, lower deductible plan might work better for you. Now I want to talk about those high deductible health plans, specifically in regards to HSAs. This is something we get asked about a lot. So an HSA is a health savings account, and they are only offered as a benefit of a high deductible health plan, or HDHP. Now, not all HDHPs will offer an HSA, but if you want an HSA, you have to have an HDHP. Basically, an HSA is an account with your money in it. The amount that you contribute is pre-tax, therefore lowering your taxable income, which might make you have to pay less when you file or perhaps receive a larger refund. It can also lower your MAGI to the point where you're eligible for a much larger premium tax credit, lowering your monthly premium. Additionally, these accounts are interest-bearing, and the interest accrued is not taxed. As long as you withdraw the funds for a qualified medical expense, and the list is truly quite extensive, there's no penalty or taxation. You can even invest a certain portion of your HSA, and the earnings are not taxed. Now, if you hold on to this HSA, and you can let it roll over from year to year. The funds don't expire. If you hold on to it until you retire, you can convert it to a basic retirement account and use it as you see fit. Because of this, HSAs have what's known as the triple tax advantage. Additionally, as I mentioned, they're only offered in conjunction with an HDHP, high deductible health plan. Usually you'll notice that high deductible health plans tend to have lower monthly premiums. It's not always the case when it's a plan that offers an HSA, but it's something to be on the lookout for. Now in 2026, the maximum HSA contribution limit for an individual is $4,400, and for families it's $8,750. To qualify for an HSA, your HDHP must have a minimum deductible of $1,700 for individuals or $3,400 for families. But as you'll see when we look at the plans, usually it's much higher. Now, one of the best things about the ACA and marketplace plans are the 10 essential benefits. All plans must offer at least these 10 essential benefits, although some may choose to offer more. Also, remember, there is no medical underwriting with ACA plans. That means you can't be charged more or denied based on any type of pre-existing condition. So as far as the 10 essential benefits, all plans must offer ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drug services, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services and chronic disease management, and pediatric services including oral and vision care. If you're an adult in need of dental or vision coverage, then you can choose an add-on on the marketplace. However, I would just like to note that private insurance for dental and vision is so much less expensive than people tend to imagine, and it will offer you much more flexibility. So you may want to look into that, especially for dental coverage. Now, if you have any questions about marketplace plans or health insurance in general, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers. We're licensed nationwide, and there's no charge for our services. Although I'm going to try to be as specific as possible in this video and when talking about navigating Healthcare.gov, the truth of the matter is health insurance is just confusing, and it's much easier to have a broker on your side to make the enrollment process just that much smoother. Now, as I've said once or twice during this video, there has been non-stop news in the health insurance sphere, so please make sure to subscribe to stay up to date, and of course, please make sure to like this video so we can get this information out there. All right, let's take a look at Healthcare.gov. So plans are finally able to be previewed on Healthcare.gov. If you click over here where it says See Plans, it will take you to the See Plans and Prices page. Now this is previewing 2026 plans. However, we won't be able to actually enroll until November 1st. So you will put in your zip code, and then it will ask you several questions about your household. Now, of course, you can skip these steps, but answering these questions is going to determine whether you are eligible for premium tax credits or not. Now, of course, at the recording of this video, we are still in the government shutdown, and who knows if those premium tax credits will in fact be extended when we're referring to the enhanced premium tax credits. So this is how things currently stand. We're going to skip this question. We will put it's us and other people. We will put married, continue, and that we have dependents. We'll put 2 dependents, meaning people that you claim on your tax return. Let's tell us about you. Now it's going to ask if you're eligible for health coverage through a job, Medicare, Medicaid, or CHIP. It asks this to determine your eligibility for a premium tax credit. If you are eligible elsewhere, then you would be ineligible for a premium tax credit most likely. It also asks if you're a legal parent of a child under 19, pregnant for the purposes of Medicaid, tobacco, etc. So we're going to put a legal parent because we did say that we have 2 dependents that we will be claiming. Continue, we will put our spouse, who is also a legal parent, none of the rest of these, continue. And let's see, we'll mix it up a little. 4-year-old male, who's obviously none of these, continue, and we'll put another 4-year-old male. Again, none of these, obviously not pregnant or tobacco user, continue. It will ask you to confirm your household members, just make sure all this information is correct. Confirm, and then we're going to put in our income for 2026. Now, I actually just did this recently with this same income for another video, and the premium tax credit was a little bit different. So let's see. This is our estimated savings. View plans. Oh, I do want to mention, actually, let me go back and show that to you again. You may be eligible for extra savings if you pick a silver plan. This is based on the income and the household size that I put in. So in this case, if this were our income and this were our household size, we would definitely want to put a keen eye towards those silver plans because it will offer us additional cost savings, not only with a monthly premium, but deductibles, copays, and coinsurance. So it could certainly end up being much better for us in the long run. View plans. So currently there are 81 plans available. Currently it is filtering by lowest monthly premium. Now, as I said, I actually did this recently on 2025 plans, and there were several plans with the same income, same household size that were available for $0 per month. So we can already see that this is an increase. Now, I put in an income that is perhaps on the lower side for a family of 4. So I am still seeing a significant premium tax credit. However, if those enhanced premium tax credits are not extended, then the average individual would see a much larger increase than $50, $78, etc. Okay, so here's all the plans available. As I said, it's currently sorting by lowest premium. You can also sort by lowest deductible because, as I mentioned, low premium plans, great for someone with more average or basic health needs, looking to take advantage of low monthly premiums and have a plan in place should they actually need to utilize their health insurance. Lowest deductible / lowest out-of-pocket maximum, better for people with more extensive medical needs who perhaps are willing to pay a little bit more on a monthly premium because they are going to be utilizing their health insurance more frequently. We'll leave it at its lowest premium for the time being. You can also add filters. Up here, important, your monthly premium. If you know that you have a very strict budget and you can only pay $500 per month for monthly premiums, then you need to put that in. We're deleting for right now. Easy pricing. Oh, this is very, very helpful. So easy pricing plans have the same out-of-pocket costs and care before deductibles for some services. This is great. This is definitely something that you want to look towards. It's unfortunate when you look at some of these plans and you'll see that even a visit to your PCP or a specialist, you have to meet your deductible first, and those deductibles can be thousands of dollars, so that's not really helpful. Now, of course, that doesn't include preventative care, but a trip to the urgent care, you're going to need that over the course of the year. So it's these easy pricing plans are great. You will see some plans have the easy pricing, some of them don't. So I'm seeing bronze, silver, and gold. I don't see any platinum plans available. Not that uncommon. But you could, if you're specifically looking at silver, you would want to click that, but I wouldn't necessarily filter based on bronze, silver, or gold because you just don't know until you're comparing the plans. Maximum yearly deductible, you can filter by that. Health plan types. This is important. EPOs, HMOs, and PPOs. If you are someone who sees a specialist who is going to be out of network, doesn't accept many plans, you need a PPO. If you're someone who travels nationwide and you need access to nationwide coverage, you need a PPO. Don't even bother looking at an HMO because you're going to end up having to pay completely out of pocket to go out of network, and that will end up costing you in the long run. Now, if you're someone who, just maybe needs a little bit more flexibility, you don't want a referral to see a specialist, then an EPO could work as well. But if you are someone who specifically needs out of network coverage, just look at PPOs because an HMO is going to end up costing you so much more in the long run, even though those premiums may be lower on a monthly basis. Insurance companies. This is also something that is very, very important. So if your doctor accepts Aetna and Blue Cross and Blue Shield and United, then filter by that. You want to make sure that you stay in network whenever possible. Medical management programs, we'll look at more of these in just a minute, but if these are things that you need additional, management with, then you're going to go ahead and click that. Health savings accounts. If you are in need of a health savings account because you are a member of the FIRE community looking to retire early, you want to lower your MAGI to maximize those premium tax credits, you're someone who's investing with your HSA, then go ahead and click eligible for HSAs. We will likely see many more HSAs this year than we have in the past, so it may be a little bit easier to find an HSA than perhaps you had found in the past. Also, if you already know your medical providers and prescription drugs, go ahead and put those in as well. You want to make sure that your provider is in network. You want to make sure that your prescription is on your plan's formulary. And you want to be able to compare your prescription drugs costs when comparing plans. There can be a stark difference from one plan to another. So I'm not going to put any of these filters on right now. I just wanted to walk you through exactly how the filters work and what you can filter based upon. So we'll click cancel. All right. So again, here are all of the plans. This is the first plan with the lowest monthly premium based on our tax credit eligibility. So this plan for a family of 4 is $43.50 per month. That is for everyone. That is not your individual rate. That's the family rate. The deductible is $1,400. That's the family total. When we compare these plans more specifically in just a minute, you'll see the individual deductible as well as the family deductible. And the out-of-pocket maximum is $21,200. Again, that's the family out-of-pocket maximum, not individual. We will see that in just a moment. So let's see, does this plan have the easy care? Yeah, it probably does have easy pricing. I'm not seeing it, but if I wanted to filter based on easy pricing, we would see, which plans specifically have it. But I can see here, primary care, $95 visit from day one. Specialist, $175 from day one. Urgent care, $175 from day one. So it's not telling me that I have to meet my deductible before I have any access to care that is non-preventative. Emergency room, things like that, you're pretty much always going to have to meet your deductible first. So we can count that out. But more of our basic care, you would like that to be included prior to meeting the deductible, especially look at this deductible. That would be absurd to expect you to meet that deductible before you can go see a specialist or a PCP. Now, we will see in a moment when we compare this plan to a plan with a higher monthly premium. Look, these are high copays. To go see your PCP, $95, specialist, $175. That's because this premium is so low. They're making up those costs here. So low, you can see already, low premium, high deductible, high out-of-pocket maximum, higher copays and coinsurance, just the way it is. But we are going to compare this one. You can compare up to 3 plans, which we'll see in a moment. So that way you have a better idea of what the spectrum of plans might be. So this is a more bare bones plan. Lower monthly premium, higher costs when we actually utilize the insurance, and you'll see some of those additional benefits in just a moment. Now let's scroll down. Okay, this is another bronze. Another bronze. Oh, that's funny. So this one actually specifically says easy pricing. This one doesn't, but I would consider this to be easy pricing because it's specifically saying from day one, not after you've met your deductible. That's unusual. Maybe it's a glitch. Anyway, let's scroll on down. We're looking at bronze. Let's try to find one of those silver plans with the extra savings. Okay, I am going to filter for that. Okay. Let's look at that. Apply filters. Okay. Much higher monthly premium, lower deductible, lower out-of-pocket maximum, much lower copays. Let's see. Is that the one I want to compare? Let's compare this one. Yeah. Okay, let's compare this one. And then, let me see. I want to compare one more plan. Let's go to I'm going to remove this filter. I'll look at a gold plan. Apply filters. Let's see. $15. Yep, you can already see. Oh, wow. So this is a little bit more per month, but that deductible is much lower. It is a separate drug deductible. It's still a pretty high out-of-pocket maximum, but these are relatively low, your copays and coinsurance. Let's see, $30. All right, well, let's go ahead and compare this one. Compare. And then we go up here, compare 3 plans. You can do up to 3 at a time. See, this is the only one that specifically states easy pricing, but I would consider these to be easy pricing as well. So maybe there's a glitch with that filter. Anyway, so monthly premiums for $43.50, $466, $565. So a pretty broad range here, but we can see the deductible, $7,000, your individual deductible versus $14,000 family, $3,000, $6,000, or $2,200. Let's see, $2,200 individual, family. Wait, oh, your family deductible. Sorry, your family deductible is $3,600. Okay, and there is a separate drug deductible here. Sometimes that is the case. So if this is the case with your plan, basically for all of your medical spending, so visits to the doctors, lab work, etc., the deductible is $1,800. The drug deductible is $400. So this only applies to medical spending. This applies specifically to prescription spending. So even if you had spent $1,800 in medical spending, you would still have to meet your drug deductible before the insurance begins to contribute to the cost share. We'll scroll down and look at that more specifically in just a moment. I also want to talk about the individual deductible versus the family deductible. So if you are on a family plan, if you as an individual have not met, in this case, this $3,000 deductible, but your other family members, let's say, okay, let's talk about mom, dad, and we had the 2 kids. Let's say that mom hasn't spent anything this year. She hasn't been to the doctor at all. But child number 1 has broken a bone and they've spent $2,000 towards their deductible. And child number
two had to have surgery and they spent $2,000 towards their deductible. And dad had to have some procedures as well, and he spent $2,000 towards his deductible. Well, not a single individual met that $3,000 deductible, right? But the family deductible has been met. So each individual on this plan will have been considered to have met their deductible, including mom, who hasn't spent anything. So if you are on a family plan, and these same rules apply to the out-of-pocket maximum, if you are on a family plan, it's basically just a little extra way that can help you save money. Same thing with out-of-pocket maximum, except of course with the out-of-pocket maximum, that means that your insurance carrier takes on the remainder of the bills for those covered in-network services for the remainder of the year. So here we have an EPO, an HMO, and another EPO. I didn't select a PPO, unfortunately, but if we were to have selected a PPO, we would see that there was a deductible and an out-of-pocket maximum for in-network and out-of-network services. Two separate deductibles and out-of-pocket maximums. Bronze plan, silver plan, gold plan. We would also see our medications if I'd put that there. Star rating, sure, you can look up the star rating. This seems to be a newer plan, so it hasn't been rated yet. Plan documents, highly important. Maybe don't get into it at this stage, but once you've sort of narrowed down which plans might be best for you, you definitely want to look at the summary benefits, you want to look at the plan brochure, you want to look at the provider directory, and you absolutely want to look at the covered drugs. I'm going to jump over costs for medical care and discuss prescription drugs for just a moment. Here it's going to break it down. So it's breaking it down into 4 basic tiers: generic, preferred brand, non-preferred brand, and specialty drug. So for this one, generic drugs, $25, $20, $10. For preferred brand, 50% coinsurance after deductible. So they're definitely making up for that very low monthly premium here. You will not have coverage for a preferred brand drug, and sometimes people do have to take a brand name for whatever reason. Usually the generic should work just as well, but sometimes the generic isn't available, or for whatever reason the generic doesn't work for you. I have known people that has been their experience. So if you are such an individual, you would have to meet that $7,000 deductible before your insurance would pay even 50% of the medication. So you can see where they are making it up already. As opposed to this plan, $40, no discussion of deductible. And this plan, $35 copay after deductible. However, this is that plan with the separate drug deductible. So no, you are not having to pay $1,800 out of pocket. You're having to pay $400 out of pocket. So we're already seeing that the silver plan seems to be weighing in our favor with prescriptions. Let's scroll down. In-network 50% coinsurance after deductible, already starting to really stack up there. Non-preferred brand drugs for this one, $80 copay after deductible. Now, unfortunately, that deductible is still significant. It's $3,000, so you would have to spend a significant amount before you would have a copay, but an $80 copay is going to be much less than a 50% coinsurance. Coinsurances can really stack up. If, medications can be $1,000. And for this one, $75 copay after deductible. But again, that deductible is only $400. Specialty drugs, 50% coinsurance after deductible, $350 copay after deductible, 50% coinsurance after deductible. So this might be your best bet depending upon the actual cost of the medication. If it's a less expensive medication, then 50% coinsurance, because we have that lower deductible, might be better suited for you. So this is why we say that there is no real one-size-fits-all solution to healthcare, because if you were just looking at the monthly premiums, you would say, there's no way that I would pay this. How are these plans even comparable? However, if you are someone who takes prescription drugs regularly, this separate drug deductible is the fact that it has a separate drug deductible, that it's $400 as opposed to having to meet a $3,000 deductible or a $7,000 deductible and then pay those high coinsurances. This plan would likely save you money. All right, I'm going to go back up to costs for medical care. So let's take a look here. Deductibles, we've already discussed these. Out-of-pocket maximums, we've discussed these. PCP, so in-network, $95 visit from day one. No out-of-network coverage because we're talking about EPOs and HMOs. Limits includes $0 for the first 3 visits. Very nice, $0 for the first 3 visits. So there is a little bit of flexibility there, basically. So it's $95, but you have 3 visits without having to pay. So that is a little bit more reasonable. $40 visit from day 1, also pretty reasonable. Specialist, $175, $80, $40, more reasonable. Preventative care, as I said, these will be covered at no cost to you. X-rays and diagnostics, so 50% coinsurance after meeting your deductible. That's going to be significant because it is a high deductible. 40% coinsurance after meeting deductible, a little bit less because the deductible is lower. 30% coinsurance after meeting deductible, certainly the most reasonable because that deductible was the lowest, and 30% when we're talking about services that can be rather expensive is going to be much less expensive than 50%. Lab work, same deal. Outpatient, very similar. Let's see, hearing aids. You should also know that hearing aids are now available over the counter in most drugstores. Eye exams, eyeglasses for children, health savings account, because it's a bronze plan, so we have a health savings account eligibility. Let's see, generic, we already talked about medications. Access to doctors and hospitals. None of these are PPOs, so we're going to see no across the board. And you need a referral to see a specialist. No. Urgent care and hospital services. It'll break down these costs more. Urgent care, $175. Out of network, $175. Oh, it'll let you go out of network for this one. Interesting. In network, $60. No out of network. In network, $40. Out of network, $40 as well. Emergency room care. In network, $50. So even though these plans are HMOs and PPOs, in the case of a true medical emergency, please head to the nearest emergency room. Don't be looking up what's in network and out of network. You will still have access to the same rate regardless if it is a true medical emergency. Inpatient hospital stay. Okay. Cost coverage and examples, it's always the same. It's a healthy pregnancy, managing type 2 diabetes, and a simple fracture. So you can see what these costs would be. And as expected, this plan is the most expensive, lowest premium, highest cost of care. Dental coverage, medical management programs, that's what I had mentioned earlier, if you wanted to filter based on that, if that's very important to you. Now, you can see some plans and details may change when you fill out an application. Very important to keep a keen eye. Don't just take this at its word. Always, take everything with a grain of salt. Make sure that all the information that you're seeing here is completely 100% accurate. And you can usually find more accurate information in the summary of benefits, plan brochure, provider directory, list of covered drugs, etc. So these are some of the most important things that you need to look at when you are comparing plans. Let's go back to plans really quickly. I do want to see, let me see if I can find some of these plans that don't have, I did want to explain that to you. Actually, I'm going to look at a bronze plan because that's more likely. Okay. I did want to show you this as well. Let's see if I can find this. And who knows, maybe I can't. $40. Yeah, this is funny. So when I looked the other day, I was seeing more plans that basically didn't have care from day 1. It was showing that you had to meet your deductible first. So perhaps these plans that I'm looking at now, that's no longer applicable in this area. But again, do take that into consideration. I'm hard pressed to imagine a scenario wherein you would save such a significant amount on your monthly premium that you wouldn't want to have access to basically any care until you've met your deductible. We did see, you have access to 3 visits and telehealth, but please look at those details very carefully. You don't want to enroll in a plan just because it has a cheap monthly premium and then find out, well, great, I only have to pay $25 per month, but I basically can't do anything unless I've spent $14,000 out of pocket. So those are some of the more important things to look at when comparing plans. And of course, you would also see, if we wanted to look at that as well, you could add on dental and vision since your plan likely won't cover it for adults. That being said, dental and vision are also readily available off the marketplace by private plans, and they're usually very inexpensive and will offer you much more flexibility.
Now this year, open enrollment will run from November 1st to January 15th in most states, although that may change in years to come as well. If you have questions, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers, we're licensed nationwide, and there's no charge for our services. We're more than happy to help with the enrollment process or answer any questions that you may have. Of course, before you go, make sure to like this video and subscribe to stay up to date, and we will see you next time. Bye-bye.